since I've been here, we have grown so big. We initially had the main hospital, Wake Forest Baptist, as well as Davie Medical Center and Lexington, but then we added Wilkes Medical Center, as well as High Point, which was a huge addition to us.
We have a 100-year history of serving this community, and especially at a time where the innovation and pace of discovery in science is growing like no time ever before in history. So while we live in a challenging world, it's an amazing time to get to deliver care at Atrium Health Wake Forest Baptist.
As the only academic medical center in our community, we bring to the community a special expertise in our services and in our select services. We are the only NCI designated cancer program in our region. We have Brenner Children's Hospital, so we are the only fully dedicated pediatric hospital in our region. And in terms of traumatic injury, we are one of the only burn centers in the state, so we provide high-quality burn care for adults and for pediatric patients.
We are so fortunate to be a part of, the Advocate family, Atrium family. Overall, obviously that has allowed us to think very boldly about where we go and really served as a backstop for some of those decisions that we know we need to make, where our patients need us, our employees need us, our families and friends need us to be. So that partnership, those combinations that we are now part of, that helps us, think very boldly about the future.
The academic core was this unique terminology that was birthed during our initial Wake and Atrium coming together. And it really refers to a role to play, which simply means really, on behalf of the enterprise, we have an overarching coordinating and/or leadership responsibility for all things academic across the enterprise. To think about now, the third largest health system in the United States that has at the center of its being academics, and then us playing the role as the academic core to help bring that to bear, that's exciting. And that's a game changer in my opinion.
Atrium Health Wake Forest Baptist and the Wake Forest University School of Medicine will continue to lead as we continue to train the next generation of healthcare professionals and biomedical researchers as we develop new cures and we get those cures to patients and communities as quickly as possible. We're also growing our campus. We're developing a new campus in Charlotte. That's so exciting for us because we'll be able to nearly double the number of students that we're training over the next 10 years.
We are helping prepare for the next generation of either physicians and/or science and/or products. We have an opportunity, but we have an obligation to take that opportunity and be successful.
Our team works to look for opportunities for strategic growth, but we're also looking to ensure that we are fulfilling our For All mission and how we can do great things by ensuring that every patient in every community has access to the care that Atrium Health Wake Forest Baptist provides.
We're so excited as we're building our new critical care tower, new outpatient hours, new inpatient ORs, as well as a new eye center downtown Winston-Salem. Lots going on to increase us. We've started off at $1.8 billion and now we're close to $5 billion. And then as we go forward with new clinics in Greensboro, we're even going to grow larger.
Growth leads to we impact more lives, okay? So that means not just our clinical care, also our academic mission, also our research mission. As we grow those areas, it impacts more lives. So we have a number of different initiatives we have in the clinical arena that have to do with reaching the underserved in terms of our health care to advance healing for all.
So I think with our commitment for all, population health sort of covers a few things. It is about improving the patient experience, lowering the cost of care, which means lowering the cost of care for patients as well, improving quality, and then improving provider experience. It's being able to have the capabilities, leveraging the research and innovation we have as part of the School of Medicine to be on that leading edge of value-based care.
We live in a digital world. Technology is front and center for a lot of the ways that we deliver our care, carry out our research, or teach. And so as we grow and evolve as an organization, it gives us an opportunity to look at all the technology and the technology-enabled services that our teams deliver and really sort of try to figure out what the future looks like, how we can deliver the curriculum of the future, how to really push forward our research programs, and how to deliver cutting-edge care for the 21st century.
Our market is special, and it's the people that make it special. And really translates to the care we give to our patients and ultimately to their families and community.
We want to be able to have people see themselves in all of our work, to know that they are included. It is just about being kind, compassionate, and honoring people's humanity so that they feel included, but they also feel that sense of belonging. The justice piece will come if we just treat each other with respect.
We will always stay rooted in our local communities, and that's really important because at the end of the day, everybody understandably wants to know that they're going to be able to get the same level or higher level care right in their own community.
You know, Wake Forest has always been a really great health system, but now that we're combined with Atrium and Advocate, we have a scale that is unprecedented for academic health systems, and I think we can really redefine how healthcare is practiced in the United States.